then in bed one night I heard a pop, felt a pop there, and the pain started, and it was pretty bad. I've been on it though. And then I thought it was going away, and about 3 weeks ago it started up again.
Okay.
And it's just right there.
Right there on that medial knee.
And it's one of those deals that if I sit for very long or stand still, then it takes a while to get moving. If I'm walking for a while, I can kind of, but other than that, but really no swelling.
Okay, so when we do an initial intake, one of the things that you might kind of start looking at doing is 21 questions. Why 21? Because it's one more than 20. And so it just really gets you a lot of information. So I asked him what happened. He did just a really good job and answered a lot of my questions that I would normally ask. But number two is, did it swell after you initially injured?
No, it really didn't.
Okay. So did you notice any popping after?
Just that one night.
Okay. So when you
And
walk,
that's when
you
the
don't
pain
see a...
really started. It didn't bother me for about, I would say, 7 to 10 days after that fall.
Really?
And then that pop the next morning is when it started telling.
And so now 7 months later,
I'm still here,
when you do the sitting for a long time, do you notice a stiffness afterwards or a pain?
More of a stiffness.
Okay. And when you're walking, does it progressively get better, or is it?
It gets better as I stay up on it.
Mm-hmm.
Yeah.
Do you currently do exercise for recreation or anything like that?
No.
Okay. So if you would say, or if you were asked if you've done anything for it, would there be an answer to that other than just rest, or?
And hadn't had much rest on it.
Yeah.
So really nothing.
Okay. So in your occupation, do you notice anything different about your pain?
No.
Okay. So moving around just for work purposes doesn't change it much?
No.
Have you done anything to help with the symptoms at all?
Just ice, with that first round, just some, after that pop, some ice pack and things like that, but other than that, no.
No pain
And
meds?
it had gotten better now.
Yeah? So you noticed an improvement?
Yeah, it had gotten better till about 3 weeks ago. I told Cher, I said, I think it's going away, and then all of a sudden, came back. It wasn't completely gone, but it was manageable, and now it's back to where it's hurting.
That's interesting. So what did you think you kind of did in the first place?
I don't know. I guess when I fell off, I must have hit right there.
You do
with
believe
no pain till that pop.
Okay.
And
And you do believe you landed kind of on that spot?
I had to. I guess I did, but I'm not 100%. But I had to have fallen right, hit that knee.
So when you came off the ladder, did you kind of more go to your back or your
Kind
front?
of went to the side like this.
Okay.
And I guess I got in right there. Would be my thought.
Well,
This side was scraped up, so it had to have been, yeah.
okay. Well, you mind if I slide you back and take a
No.
look here? So one of the things about a knee eval is you clear ligaments first, and you'll see Bill do that too when he does evals, is he likes to clear the ligaments. Before I even start focusing in on those ligaments, I just kind of get a hold of that kneecap, and that's not as big of a deal in a clinical setting, but you know, if it's an athlete and they run in, I'm kind of like wanting to make sure that kneecap's in place, and so I'll just do a quick little look at that kneecap. Not necessarily doing joint mobs. I'm just making sure it's where it's supposed to be. And I'm gonna actually take his jeans down just a little bit, that way I can kind of get a little better feel. I know that doesn't do you good because you can't see exactly what I'm doing. My first test, and it's done because it has high specificity as well as high sensitivity, is it's known as Lachman's, Lachmans. And what you do is you stabilize a distal femur, and then you kind of elevate the femur from the hip, and then I'll stabilize there, and then I'm just going to take and kind of just pull out. The ACL restricts anterior translation of the tibia, And many times I actually take them over, and I find this is just a little more efficient of a method. And I don't have a whole lot of infill right there. So the next test would move to an anterior drawer. Think about taking a drawer out of a cabinet. Same thing though. Looking for tibial translation anteriorly. And then the test is known as valgus test because it repeats valgus stress. So what ligament do you think I'm looking for here? Did that hurt?
A little bit, yeah.
You can see, and he's hinging. So what ligament am I testing?
Lateral, collateral. Oh wait, no, that's not a thing.
It is a thing.
Is that the one you're testing?
No.
Okay.
But it is a thing.
Okay.
When I was taking that, I was
Oh, you're going the other way, so the MCL.
the medial collateral, correct. Now, two things came up from that. Number one, clinically, I could see his knee hinge. Just like a door on a cabinet, it hinged. Two, though, he distributed a reaction, right? So, I'm thinking, yep, that's what's the culprit, probably. Now, one more thing, just to kind of help us understand is, I'm going to kind of palpate that joint. Is the pain right there?
Just down just a little more right in there.
Okay. And that helps me to confirm because I can put my fingers on the MCL right there. In fact, it's a thick fibrous ligament and I'm just right on top of it right there. So that definitely makes me think, could be it. So in that instance, what I would normally do is I would tell you, because it's been 6 months and you're still having symptoms,
Right.
that it could have gotten into the medial meniscus.
Okay.
It also could have been that you tore some of the retinaculum around the knee, but I don't know. And so in this case, that's when we would like to see an MRI scan on.
Okay.
Unfortunately, that leaves us to a point where we're like, stop, refer, and move forward. But I am kind of also a little worried about that ACL. But that could just be your knee is not letting me. I think that's it right there. Yeah, there it is. Feel that thunk, 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 thunk. That's good for his ACL, bad for his MCL. The MCLs usually heal on their own though. So, 6 months should have healed up. Since it didn't, that makes me worried that there's fibers that are shared by the MCL and the medial meniscus right in where they come together. And sometimes that's where a tear can happen. And if that's the case, still needs to be seen by surgeon.
It's right at the edge of the meniscus.
Correct. So that's my thinking is we need to get you referred.
Sounds good.